For more on this story, we can bring in our chief foreign editor, Rob Parsons. Rob, great to see you. 4 days of strikes just this week. This inconveniences people a lot, but the public seems to be backing the strikes.
Yeah, I think that there's a perception in the public that the health workers have had a raw deal. You know, their real wages have gone down over the last approximate 15 years by 4%. And the public recognise, I think, that nurses, ambulance workers, young doctors have played a critical role in the last few years, in particular with the COVID pandemic, when everybody knows that they were putting their lives on the line. Many did indeed die, and they recognise themselves, I think, the public, that the service provided by the NHS is not what it was, that there has been underinvestment, despite that promise that was made back at the start of the election of the Brexit campaign by Boris Johnson, that there would be a dividend of £350 million per week for the NHS. And there has been no dividend whatsoever. And just in the last year, 25,000 nurses left the profession, and before that, many foreign nurses left because of Brexit as well. So the NHS has suffered, I think, because of that, and because of the central role of the National Health Service in British life, and the fact that the vast majority of British people go through the NHS for their healthcare. People have seen it suffering, and they want it to improve, and they blame the government rather than the nurses. The government, after all, have been in power solely since 2015 and in coalition since 2010. So they can't really blame anyone but themselves for the state that the institution is in now.
And obviously the government is getting pressure from the streets. And instead of trying to figure out a solution, they're saying that if they were to increase salaries, it would worsen the inflation problem. What is their plan here?
There doesn't seem to be much of a plan. The government says that they've had talks with the nurses and they've been constructive. The nurses say there have been no talks at all, constructive or otherwise, and that the government simply refuses to talk about the possibility of a pay rise. It is damaging, no question of it, for the government at a time when it's struggling in any case with scandals concerning the chairman of the party over unpaid tax and accusations of bullying levelled against the Deputy Prime Minister, Jeremy Hunt. The government is needing good news, and to be sucked into constant rows with popular groups like the nurses and the teachers who were on strike last week, the biggest day of industrial action for decades in Britain, is not going to be very good for the government. Rishi Sunak has been trying to paint the nurses as militants. It's not washing with the British public, and all the time he's slipping in the polls. And the best estimate, best guess seems to be that there will be a general election in May 2024. It's not just a little bit more than a year away. The Conservatives are 20% behind Labour in the polls at the moment, and Rishi Sunak himself is 12% behind the leader of the opposition, Keir Starmer. It's not looking good for the Tories.
We'll see how this week pans out. Thank you very much for that, Rob. Rob Parsons there.